This conference will now be recorded.
Hi, everyone. Thanks for joining us this afternoon for From the Front Lines, a series of biweekly media updates from the Pennsylvania Healthcare Association to share insights from the front lines of the COVID-19 pandemic in Pennsylvania's nursing homes, assisted living communities, and personal care homes. This week, PHCA President and CEO Zach Shamberg will share some of the key workforce challenges facing Pennsylvania's long-term care sector and newly proposed legislation that will support long-term care workers as they face the continued threat of workforce shortages. He'll be joined by State Senator Judy Ward and State Representative Curt Sonney. Both Senator Ward and Representative Sonney have introduced new legislation to amend current state law allowing temporary nurse aides hired during the COVID-19 pandemic be placed on the Certified Nurse Aide Registry. This virtual press conference is being recorded and will be available to you on the PHCA YouTube channel later today. As a reminder, please set the GoToMeetings view to active cameras. At the conclusion of today's press conference, there will be an opportunity to ask questions. Please use the chat feature within GoToMeeting to let us know you have a question, and you will be unmuted at the appropriate time. If you'd prefer to email your questions, feel free to do so at svarner@phca.org. Thanks again for joining us, and I'll now turn it over to our President and CEO of the Pennsylvania Healthcare Association, Zach Shamberg.
Thank you, Shana, and thank you all very much for joining us today. A few months ago, at the height of the COVID-19 pandemic, the term healthcare hero was born. And it was used to describe the brave men and women on the front lines of the battle against this terrible virus and the risks that they were taking to protect their residents, our most vulnerable, the senior citizens of Pennsylvania. And the term healthcare hero could not be more fitting for the workers in our nursing homes, personal care homes, and our assisted living communities. They're the nurses, nurse aides, physicians, and the staff who are at the epicenter of this pandemic. On any given day, more than 125,000 Pennsylvanians are cared for in nursing homes. And while that may seem like a large number, it's worth noting that Pennsylvania is currently the third oldest state in terms of population in the entire country. Our fastest growing demographic age 85 and older, and we're roughly 3 to 5 years away from the silver tsunami, the time in which our baby boomers will age into the demographic most in need of long-term care. So needless to say, we'll need to ensure that we'll be able to care for our seniors, not just today, but years from now. And the healthcare heroes in our long-term care facilities need our support. Even heroes need help. So let's rewind the clock back 1 year, long before the COVID-19 pandemic began in Pennsylvania. Back then, long-term care providers were facing arguably the greatest workforce and nursing shortage in the history of our sector. The issue was so concerning, in fact, that our Auditor General, G.D. Pasquale, released a report that was called "Who Will Care for Mom and Dad?" And that report focused almost entirely on the need for more caregivers across the Commonwealth. And various studies have reported that thousands of positions in long-term care facilities will go unfilled. We simply do not have the workforce available to ensure quality care for our senior citizens. And why is it so hard to find qualified staff? Well, one, it's not easy work. It takes a very special person to work in long-term care, someone who's dedicated, someone who's compassionate and willing to sacrifice for those they serve. But more importantly, it's wages, benefits, and support. Wages haven't kept up with other sectors and industries, and that includes retail or service industries. Why? Because 2/3 of all residents in our nursing homes receive care paid for by the state's Medicaid program. And that program has been chronically underfunded for the better part of the last decade. So while private business or other industries may be able to pass costs on to their consumers, long-term care providers can't, even as their operating costs rise and their funding remains painfully stagnant. For providers to support their workers, the Medicaid program must first support those providers. As an association, we at PHCA have worked to address these issues and the challenges that face our providers by partnering with local workforce investment boards and other community partners to improve recruitment, to improve training, retention, and career advancement. We also established a first-of-its-kind statewide provider workforce committee that will be used to guide these initiatives and prioritize investments in workforce development. Now, we did all that in 2019, but then the COVID-19 pandemic began, and the challenges that existed in long-term care were exacerbated, and none more than our workforce crisis. This March, to help alleviate some of those challenges, the Centers for Medicare and Medicaid Services, or CMS, suspended many regulatory and statutory provisions to help long-term care providers. And the Wolf administration here in Pennsylvania did the same. One of the most significant waivers gave providers the ability to recruit and hire a brand new worker, the temporary nurse aide, or TNA. This position helps provide aspects of resident care that include the activities of daily living, infection control and prevention, and nutrition, all after the completion of an 8-hour online training course and hands-on training in the facility. I'm very proud to tell you that since this program was formally approved in Pennsylvania back in April, more than 2,500 Pennsylvanians across the entire state have completed this training and have been hired to assist in the response to COVID-19. So at a time when tens of thousands of Pennsylvanians were losing their jobs, long-term care was hiring. Nearly 70% of our PHCA members hired temporary nurse aides. And of those individuals, we're learning the vast majority wish to continue their employment even after the COVID-19 pandemic comes to an end. But that's the reason for this press conference today, because when those federal waivers expire and when state emergency declarations end, these temporary nurse aides will be forced to vacate their jobs, and they will not be deemed qualified or eligible for our state nurse aide registry. In all, the thousands of jobs that have been created will all be lost in an instant. And that's why we are very proud and very honored to work with State Senator Judy Ward, a former nurse and the chair of the Senate Aging and Youth Committee, and State Representative Curt Sonney, chair of the House Education Committee, both of whom are with us today and introduced new legislation to amend current state law to allow temporary nurse aides to be placed on the Certified Nurse Aide Registry and to continue to be able to provide care. Those bills are Senate Bill 1268 and House Bill 2830, respectively. And that's just one simple way to preserve and to honor our healthcare heroes. I want to turn it over now to State Senator Judy Ward for her remarks. Senator, thank you very much again.
Zach, thank you so much. And I'd like to begin by thanking you and PHCA and Leading Age for their assistance during this pandemic. You've worked very, very hard to keep the people and the facilities that you represent safe, and it hasn't gone unnoticed. So I want to thank you. The pandemic's been difficult from many different angles, but what your agencies have done and the agencies that you represent have really, the work you've done has been commendable. So I want to thank you. As chair of the Senate Aging and Youth Committee, I became aware of the importance of hiring temporary nurse aides in nursing homes during several public hearings held by the committee concerning the needs of long-term care facilities and workforce shortages. When the pandemic started, CMS suspended federal regulatory and statutory provisions to assist in the hiring of temporary nurse aides. PHCA and Leading Age saw this as so important They worked with the Department of Health to get the waiver adopted here in Pennsylvania. Zach, you very eloquently described what it means, but in order to prevent a mass exodus of new workers from long-term healthcare facilities and to provide a pathway to full-time employment as a certified nurse aide for those who served so admirably during the COVID-19 pandemic, I agreed to sponsor Senate Bill 1268 in the Senate, and Representative Sonney has a companion bill in the House as well. Simply, the legislation allows temporary nurse aides hired during the declared emergency to be deemed to satisfy the requirements of completing a nurse aide course. The Department of Education sets the standards for nurse aide training programs and removes and recertifies the nurse aide training programs. And then the Department of State maintains the nurse aide registry. Department of Health licenses nursing facilities, and DHS is the state Medicaid agency. So each is involved to a degree. I have received over 50 messages from constituents in support of this proposal. The measure is supported by PHCA, Leading Age, the Pennsylvania Coalition of Affiliated Healthcare and Living Communities. The Workforce Development Board has also indicated an interest in the proposal. It has, in the Senate, 16 co-sponsors, and it's a bipartisan support of this measure. The measure was just referred to the Senate Education Committee this week, and we reached out to them and also made our leadership staff aware of the issue and the importance of the issue. So hopefully we can get something done by the end of the year. It is really an important issue, and after everything that the temporary nurse aides have done, it just seems very common sense to be able to do this. And let's face it, many of these temporary nurse aides have well exceeded the former requirements. So it just makes sense. It's very difficult. I worked in a development capacity for a nursing home, and I know how difficult it is to get the temporary nurse aides or get the nurse aides in the building to get them trained, and this would go a long way to help with that. So turn it over to Representative Sonney. Representative Sonney, I think you need, yeah, there you go.
Yes. Okay. Can you hear me now? Okay. Again, thank you, Senator, and thank you, Senator, for being upfront in getting this legislation moving. I'm actually very proud to be able to run the House bill, the companion bill in the House. I'm not a nurse, but my wife is, and my daughter is also a nurse, and my daughter is not only just a nurse, but she's also the director of nursing in a local nursing home. So I can assure you that I know firsthand. I hear of the struggles that are out there when it comes to finding employees. And quite frankly, when it comes to the nurses' aides, this was, we were having some difficulty in our region before COVID hit with testing sites, and getting those individuals that had gone through the program to be able to take that test to be able to get employed. And, so in my opinion, one of the good things that can come out of COVID, is this ability for these temporary nurses' aides to be able to, continue to do what they have been doing and to continue to work and serve, our elderly residents. They're an essential function, absolutely an essential function within our healthcare community, no matter what setting it is in. And we all know that the best training, is on the job. And that's exactly what, these temporary nurses aides have done. They have got the on-the-job training. And so, they are absolutely very well qualified. And, we give them a way to show that competency to be able to get that certification. So I just think it's something that is desperately needed so that we can maintain these people in our nursing homes.
Thanks, Representative, and thank you again, Senator, for your support, and both of you for your leadership on this issue. I think when I say thank you, it's on behalf of the tens of thousands of nursing home employees, tens of thousands of residents in our nursing homes, as well as our assisted living communities and personal care homes. And it's for the thousands of new temporary nurse aides who very much want to stay in our facilities and care for our seniors. So thank you again. And Shana, I think we are okay to go to questions.
Great, thanks, Zach. The first question that we have is actually about the new CMS testing requirement that went into effect this week. That testing requirement would change the way that nursing homes are testing staff based on community spread in their local county. Can you talk a little bit about the impact that this new regulation has for nursing home providers and what this means for those on the front lines?
Sure, and I'm assuming that question's for me. From the early days of the COVID-19 pandemic back in late February, early March, PHCA and our members have been supportive of universal and recurring testing in all long-term care facilities, including nursing homes, because absent a vaccine, testing really is the essential tool to keep our residents and staff safe. So we've supported that recurring testing. However, I will say this, as we learn from providers all across the state, without more dedicated funding to support those testing efforts, without stronger, more robust public-private partnerships that will direct critical testing resources to providers so that we're cutting down on those turnaround times and that we're ensuring that every provider can get staff testing done as soon as possible. Recurring testing is simply unsustainable at this point for this sector. And earlier this week, recurring testing became a new federal requirement. And as of about 2 hours ago, it's now a new state requirement from our Department of Health. So what I would say is that yes, recurring testing is the right thing to do, but without funding support, without stronger, more robust partnerships, how long will providers be able to continue doing it?
Zach, I might add, the reimbursement rate for MA has...
Another question that we had come in, this is for both Senator Ward and Representative Sonney. You touched on this a little bit in your previous remarks, but what are you hearing from providers in your districts about the workforce shortages and how this legislation specifically can help them address that shortage in the short term as COVID continues and we look to phase 2, and also longer term in addressing those shortages, as especially for certified nurse assistants?
Representative Sonney, do you want to go ahead?
Well, I was just going to say that there's not a week that goes by for probably the last 2 or 3 years that there are not advertisements in the Sunday Erie Daily Times for nurses and nurses aides in multiple locations, throughout Erie County and the surrounding area. I think we're all very well aware of the shortage of those coming into almost all professions. So it's not just simply one profession. We're seeing this across the board, and it's going to continue to be a challenge. Healthcare is, everybody's number one priority, right? We're all really very concerned about our own health, and the health and safety of everyone. And so, one of the good things that hopefully can come out of this again is, maybe that we will be able to see more apprenticeship programs started because of creating a new pathway, to get these employees in and get them on the job and working faster and quicker, and easing some of that transition into getting these new employees. And that would be a great benefit if that's what comes out of this in the end.
It's sort of like trying on a pair of shoes, right? Before you buy them. It's been nice. They could get into the job, see how rewarding the job is, and just to get them in the door, I think is a big step forward. And I think it will be very, very helpful. Like I said, I know I've been in close contact with a lot of the nursing homes in my legislative district, and all of them have the exact same concerns. Staffing, being able to hire competent and caring staff, being able to pay them a fair wage that is competitive, reimbursement from the MA reimbursement has not risen. So the other issue is, how are they going, and Zach addressed this, how do you pay for the testing moving forward? They're happy to do it. It's just very difficult sustainability with the testing, and that's going to be a big issue for them moving forward. Not that they don't want to do it, it's just the cost involved and who takes care of that.
Yeah, and I would just add, I agree with everything Representative and the Senator said. I would add that as we talk to providers across the state, I hear the word pipeline over and over again, because it's all about building the workforce pipeline and getting younger Pennsylvanians interested in a role like this. And what we're finding from the TNA program specifically is that many younger Pennsylvanians who are right out of high school, who have deferred college or who have graduated from a two-year college, are coming to work to basically, as the Senator said, try on the shoe, to see if they like this profession, to see if this is what they want to do. And the overwhelming majority is reporting back to our providers to say, this is my passion and I want to continue this, which is fantastic. I would also say that, to go back to that pipeline, we have providers who are not just targeting or advertising to folks in college, Pennsylvanians out of college, but in high school, even in middle school, to start talking about these positions are available. And again, I mentioned that Pennsylvania is the third oldest state in terms of our population in the entire country. When you think about jobs that are going to be here, not just for the next 2 to 3 years, but for the next 10 to 20 years, this is it. Long-term care is it. So the more interest that we can garner through a position like this, with online training, with easy access to learning, I think we should do it. It's a home run for providers across the state.
Thanks, Zach. And thank you, Senator Ward, Representative Sonney. It looks like all the questions that have come through today. We really appreciate you all joining us. As I said, a YouTube recording of this press conference will be shared on the PHCA YouTube channel. If you have any questions following the press conference, please feel free to reach out to me, svarner@phca.org. We'll get those questions answered for you. Thanks again.
Thank you,
everybody. Thanks, Senator. Thanks, Representative.